So today we'll be discussing a very interesting topic, that is the medicine or the drug Glimepiride versus Sitagliptin. Now we know this Glimepiride comes from sulfonylurea group. Now what does this sulfonylurea does is it goes to the pancreas and they cause increased release of insulin. So this is how they act. This Glimepiride drug actually causes increase in insulin release. They act on pancreas. That is how they cause reduction in the sugar levels. Whereas sitagliptin comes from gliptin, that is actually DPP4 inhibitor, that is dipeptidyl peptidase inhibitor. And how they act for diabetes mellitus is by potentiating GLP-1. What is GLP-1? Is a glucagon like peptide. So what actually they do is they basically boost the postprandial insulin release, and they also reduce or decrease postprandial glucagon release. So this is how they increase the sugar dissipation, they reduce glucose production, and they increase the glucose entry into the muscles. So this is how sitagliptin acts. Now, the main difference between this glimepiride and sitagliptin, there are two. This glimepiride, they do cause weight gain, whereas sitagliptin, they are completely weight neutral. So they don't cause weight gain, they don't cause weight loss. So if anyone who is slim, if they are not obese, glimepiride can be preferred. If they are already obese, then giving a medicine like glimepiride to an obese patient can again increase the body weight. As we know that they markedly increase the release of insulin, the chances of hypoglycemia is pretty there. So anyone who is high risk for hypoglycemia, for example, those patients who are elderly, those patients who are on other medicines also like insulin or other medicines for diabetes, uh, where they have this risk of hypoglycemia, glimepiride should be avoided preferably. Whereas sitagliptin on its own never cause hypoglycemia. So it does not cause hypoglycemia on their own. If someone is getting only sitagliptin, they usually don't cause hypoglycemia. But if they are given with insulin or glimepiride, they can definitely potentiate the hypoglycemia. The other thing is this glimepiride, they are high efficacy drug, whereas sitagliptin, they are not that highly effective drug. Means, for example, if someone is coming with a BSL of 200, 300, 400, and 500, usually glimepiride can be a very good drug of choice because that can markedly reduce this much of high blood sugar levels. Whereas the sitagliptin won't cause huge sugar reduction, so that can be given to those patients who have borderline sugars, or that can be used as the drug which can cause a better sugar control over glimepiride or insulin or other drugs. So if the patient has very high blood sugar levels, definitely glimepiride can cause a better sugar control than sitagliptin. This glimepiride definitely acts for 24 hours, so even once a day dose or OD dose can be sufficient. And this glimepiride can cause HbA1c reduction of up to 3 to 4 percent very easily. As I told, that very common problem with the glimepiride is weight gain. So we very commonly tend to avoid this drug in glimepiride in obese patients. But if it is the need, then we definitely have to prescribe this medicine to obese patients as well. As I told that the chances of weight gain is high, hypoglycemia is high with glimepiride. We should preferably avoid this drug in elderly patients because they have increased risk of hypoglycemia or fall, and these patients, because of the osteoporosis, may cause fracture or may get head injury or injury elsewhere. Both the drug, that is this glimepiride and the sitagliptin, they don't cause UTI. UTI causing drug is SGLT2 inhibitor like dapagliflozin or empagliflozin because they cause release, they increase the excretion of the glucose through the urine. The chances of gastritis is very much lesser with glimepiride as well as sitagliptin, whereas this gastritis, constipation, and other gut-related symptoms are much more common with metformin, and they are not much common with glimepiride or sitagliptin as well. As I told earlier also, the chances of hypoglycemia is much higher with the glimepiride compared to sitagliptin. And as it acts for a very long period, this glimepiride should be used very, very cautiously in patients with chronic liver disease or chronic kidney disease. Because in chronic kidney disease, there is increased or there is reduced excretion or reduced clearance of insulin. That is the reason why the levels of insulin remains higher in CKD. And in CLD patients, very commonly there is problem in glucose synthesis or glucose generation, because glucose is synthesized or is prepared in liver. So in chronic liver disease, patients very commonly have hypoglycemia. So glimepiride should be very cautiously used in chronic liver disease patients and in chronic kidney disease patients as well. The best part of the glimepiride is they are very cheap compared to sitagliptin. Sitagliptin, around one tablet costs around 7 to 10 rupees, so that can be problem for a very poor patients. So sitagliptin, it lowers both fasting as well as postprandial blood sugar levels. Then they don't have any effect on gastric emptying or satiety. The sitagliptin also is very commonly can be used twice a day or once a day as well. uh, on their own, as I told, they are low effective or their efficacy is lesser compared to glimepiride. So HbA1c reduction of to 1 to 1.5 can be done with the sitagliptin. The only problem with the sitagliptin is also is we need to modify the dose of sitagliptin in patients who have some renal issues. So if creatinine clearance is more than 50 ml per minute, we can give full dose, that is 100 milligram per day. If creatinine clearance is in between 30 to 50, we can give up to 50 milligram per day. And if the creatinine clearance is less than 30, we have to give 25 milligram per day. This is the sitagliptin dose. So these are all the points which are in between the glimepiride and sitagliptin. And thank you.